There's only two major companies that produce the glass vials traditionally used to hold a vaccine. If we see supply chain shortages, we will need surge capacity. And the company here in Stamford called Apiject says they have the answer. This is the Apiject injector, made of plastic, not glass. The vaccine sealed inside moments after the plastic mold is blown.
Millions and millions of pre-filled syringes can be made every month, which is exactly what we're going to need.
Originally invented as an ultra-low-cost way to get medicine to poorer countries, the company says it's ideal for filling the shelves of the country's strategic national medical stockpile and for pandemics.
You'll need enormous volumes. That's where plastic is the way to go.
The federal government has been keeping an eye on Apiject's product for 2 years. Their delivery technology is already being used for flu vaccines, but there's a concern it hasn't been tested on the sensitive mRNA COVID-19 vaccines.
This is medical-grade plastic. It does not interact. In fact, it's the same kind of medical-grade plastic that's in syringes, so you know it's commonly used.
And then there's the issue of cold chain storage. Will Apiject be able to handle the extreme temperatures?
Plastics like this can go all the way down to minus 100 degrees. And in many ways, plastics are more robust than glass.
Apiject will use money from the federal government to build a giant manufacturing plant in North Carolina to complement their existing plant in South Carolina, putting them in position to deliver 3 billion doses of vaccine every year.
We will actually be exporting to the world once we've covered the American population. This is a perfect example of America at its best.
Apiject's injector also uses 95% less energy and 60% less plastic to produce than a traditional syringe. Good news for the environment. Of course, all of this hinges on a green light from the FDA. Reporting in Stamford, Matt Caron, Fox 61 News.